Hi, this is Lynn, and I am so excited about being here today because we are at the Physical Therapy Center where I spent 14 months working on my knee that I had to have surgery on. When I very first went to physical therapy, when I first had fibromyalgia, I was in so much pain, I couldn't do anything. And so when I was told by my doctor after my surgery that I had to do physical therapy, I thought that was great for my knee, but I was really afraid about the rest of my body because it's always in pain with fibromyalgia.
Physical therapists are trained in musculoskeletal injuries and disorders, and we're here to work on range of motion, decrease pain, increase strength, and more importantly, just increase function of daily life activities.
And that's what part of the Community Pain Center is all about, is making sure that you have those connections where other people can encourage you, can congratulate you, and you can celebrate the little steps that you take each day to get better. And we're so excited that you can now share in what I learned about physical therapy right here at ProSport.
With her knee being immobilized for 14 weeks after the surgery, we usually start with a hot pack, eventually work into maybe having a person ride the bike to warm up, or an elliptical machine, or some kind of dynamic warm up. But for Lynn right now, we have a hot pack, which is very cozy and very comfortable.
Nice.
A physical therapist should do some kind of soft tissue, hands-on kind of work.
I was so afraid to touch my knee because I wanted to protect it. And I remember the first time you came in and you just started working on it, and I thought, oh my goodness, it doesn't fall apart when you touch it.
So the next step is to kind of get some movement in the knee. This is a straight traction technique to loosen up the joint. And we can do a little bit extra soft tissue and range of motion. Right to tolerance. Should be tension, no pain. And we'll do this for 10 or 15 minutes to get the joint nice and loosened up. One of the modalities that physical therapists use is electric muscle stimulation to activate muscles that have been dormant or at rest for a long period of time. So we put a little stimulator on the inside of the quadricep, the VMO, and then we use straps to make sure that the connection's very solid. We're going to turn up the stimulator. You're going to feel a little tingle underneath the pads right there. We're contracting the muscle with the stimulator. When you contract the muscle, the kneecap will come up, the knee will straighten up, and we will contract that muscle as hard as we can to teach it how to work again. During the time it comes on for 5 seconds, I want you to make this muscle as hard as you can, straighten your leg out, lift your toe up, and make your kneecap come up. So this is going to activate this muscle and relax when it comes off. And then it comes back on. This is a real common standard procedure to activate muscles that have been dormant or asleep. And this kind of reboots the muscle to make it work again. So after we're done with this for 5 to 10 minutes, we'll be doing weight-bearing exercises so that you can actually get that quadricep working on your own. When you came in here, you had crutches on, and you had really difficult time at the initial part just doing body weight squats. So one of the machines that we use on you and every day is a Total Gym. This is a sled machine which can unweight your body to about a third of your body weight, and you can do repetitions and kind of build up your strength to the point where you can lift your own body weight up. Or about a third of your body weight right here at this angle. So what you're going to have to do is push into the mat with your feet, and you're going to come straight up here. To get the inside muscles working too, we did some of these exercises.
I like these.
Yeah. So this is getting your quads and your adductors working. Remember, we went to the single leg.
This is the hard part.
Which you could just bring your leg wrist back like that. And then you're going to keep your knee right over the center of your foot, and we'll come down and back up.
I got to get back up.
Good job. Everyone that comes in here has some discomfort and some pain. They're coming off of an injury or a surgery. Some of this hurts a bit, but under the careful supervision of a licensed professional, there is good pain and bad pain. And this right now is just good muscle pain. Once we got through the sled and you're able to do a single leg body weight squat, we want to work on repetitions and build up your endurance. And sometimes we start with 3 sets of 10, and eventually we'll do 3 sets of 1 minute or 2 minutes or 3 minutes. So we're going to do a step up and step down with this leg. So you're going to come up and hold, and then come back down nice and slow, perfect. So in the initial stages, we might start with a 2-inch box, which we probably did with you, and go from a 2-inch to a 4-inch, to a 6-inch, to an 8-inch. It takes a couple good weeks of hard work and intense exercise to go from a 2-inch box to a 4-inch box.
I remember that it was almost a year before I could go up a full set of stairs and back down, like at the mall.
Without thinking about it.
Without even thinking about
Yeah.
it. And I remember the first time I did that, I went, oh my goodness, I did it.
Another part of rehabilitation is restoring your balance and proprioception, how your body feels if you get bumped or knocked there a little bit. So this is a single leg, standing on your leg and playing catch. And we normally time this for 30 seconds, so we work to 45 seconds and maybe even a minute. And of course we can make it harder.
Okay.
A little unstable surface, it's just a foam.
Going into my focusing, take a breath.
That makes you work a little bit more. So this is working your ankle, your knee, your hip, and your core.
And we know my core needs help.
And we're here to hold you, so we're all good. So just like strength can be built and improved, balance can be too. It's kind of getting your brain and ankle, just like you were doing, kind of connecting everything and retraining your body to work. These are really fun. These are called monster walks. You gotta make a face like a monster. But we're gonna squat down and you're gonna walk forward, keeping your knees apart. And this is gonna work your hips and kind of put everything together. The strength, the endurance, the balance, and everything. As a little fun exercise.
So you want to make me look silly so that I don't think about my pain.
Nice. Smile. Work.
I feel
You feel
silly.
that? You feel it?
I feel it.
Yeah.
I did it. When my doctor told me it was going to take 9 months of physical therapy, I started to laugh because I thought he was kidding. I didn't realize that with this bad an injury as I had, that it would take that much time. But he also told me that my leg probably would only bend about that much. And what I'm so excited about is that I can now do that. Despite my fibromyalgia, despite my fears, despite all of the things, it came out with a really good ending. And I know that can happen for other people too. I need to give you a hug. And thank you.
Oh, you're so welcome.